that deliver social impact. So you identify a problem, for example, poverty or inaccessibility to safe water and hygiene, and then you create a venture or a business that not only benefits you as the sole proprietor, but also delivers social impact to the entire community. So it's not like the rudimentary entrepreneurship where it's only that person who started the business that benefits from it, but also the general community benefits. So it's a win-win for both of you, the person who's creating the venture, but also the entire community. I'll give an example of, you've identified water access to clean water, safe water for human consumption is a challenge in your community. And then you think through an idea and a venture of, for example, creating some ceramic water filters, which are very cheap and very affordable. They do not require, for example, electricity to heat the water, to kill the germs. But then you use, like the ceramic, you use the pots to sieve out any antimicrobial organisms or dirt. So you're getting money for yourself as the sole proprietor of this venture, but also you're extending a service to the entire community, that they have a better option, a better source of clean and reliable water for consumption that will benefit the entire community. So this is what social entrepreneurship is about. It could be related to either health disparities, it could be a solution to addressing poverty, it could be a solution addressing social inequities or environmental degradation. So it's always having that aspect of creating social impact. Fine, you're creating a business for yourself, but also it is beneficial to the community and addressing very dire need that the community intends to solve. Then moving to One Health, like John had already said, this is just the interconnectedness of three aspects of life: the human health, the animal health, and then the environment health. So it's an approach that really emphasizes that for any of us to live healthy, either the animals, the plants, or man, to live healthy and have sustaining life, there has to be that interconnectedness, there has to be that interaction between all the three arms of life: the humans, the animals, and the environment. And in this generation, the 21st century, this is something that is really growing in interest and concern because of the challenges we all know we are facing, ranging from climate change effects, coming to the growing population versus the land we have. So people are encroaching more into natural habitats of animals. And then we have these crossovers of infections and diseases, outbreaks of a number of zoonotic diseases. And when you really look at the charts from different countries, their ministries of health, the diseases that are coming out and being reported, so much as being epidemic or causing outbreaks, we really see that these are mostly zoonotic diseases, which shouldn't be that common if we are really living in harmony with, as we are supposed to live as humans, animals, and environment. Once there is a balance in the three of these aspects of life, then we shall all be healthy. And this is our role as people in the health sector, irrespective of what you're doing, whether midwifery or public health or reproductive health. How do we ensure that all these three aspects of life are working hand in hand so that we do not cross and destroy any of the other arms to cause spillages of diseases? Yeah, like I've said, the goal of this is to achieve optimum health for all the three aspects of life: the people, the animals, and the plants. Um, the different arms of One Health Here we have public health. This one I'll dictate. I'll need somebody who's doing public health to tell us what public health is. Paul, do you mind telling us what you're doing in public health, what you're studying? Define for us what public health is. Give us an overview of what public health is about. Paul? Is Paul there? I'm sharing my screen so I can't see what's happening in the group. Justine? I'll only call out public health personnel. Justine, you want to tell us about public health?
Yeah, thank you very much. When we are talking about public health, we are talking about preventing diseases, detecting diseases, and the surveillance of these particular diseases within the community is what we are discussing about public health. And we also give more education, provide more health education to the community on these particular diseases. I think that's general overview of what the relation to.
Okay.
Hello,
Yes. Someone wants to add something?
Yeah. Yes. Public health is all about protecting and improving the health of people in their communities.
Okay. And one key thing about this is that all the interventions that are done under public health have to be implemented through joint efforts with community. So to have any successful intervention when you're implementing public health, you have to always have community engagements and community at the core of any decision you make so that they accept and embrace every intervention you're bringing. So, like already said by other colleagues, it's the art and science of preventing disease, promoting health through joined efforts of community. So you'll not wake up after you've been instituted as public health somebody, either officer in a community, and then you wake up and you're like, my community here, I'm seeing fine. It might be scientifically evidence that there is a problem going to happen. You see, for example, either you see all the steps and indications that in the next month we could have a cholera outbreak, and then you wake up because you know you're a public health specialist, you go to the community without their awareness, without involving them, and then you start implementing the control strategies of preventing a cholera outbreak. This is not how it works. So for public health interventions to be successful, always keep in mind that everything you have to involve the community, and it has to be very, very key in suggesting even interventions that can quicken the approaches you intend to use to address a particular problem. Then veterinary health, this is now the health aspect that addresses the animal arm of One Health. So it's all about to do preventing disease, ensuring that animals are healthy, and then we do not also create that spillage of zoonotic diseases into humans. So zoonotic diseases, these are just diseases that affect humans, but their source is from animals. They either could be wild animals or domestic animals. And I think from the field, this is a thing you really see there is a gap when it comes to the wildlife. Most of the veterinary medicine and health interventions, most of the times, are targeting the domestic livestock or domestic animals, and then we tend to forget the wild animals. And this, in this century, we should appreciate that they are causing a lot of trouble in human health. It's where we are getting the COVIDs, we are getting the recurrent Ebolas that are affecting our region, East Africa. So we also have to be very, very pay keen attention when it comes to wildlife. We are growing each day in number, and we have started encroaching on the natural habitats of these wild animals. So we are starting to live with them, and even consume them because of the effects of climate change. There's food shortage, and this is how we are having spillages in these different infections we are having in this century. Then when we look at environmental science, this is now the arm that looks at the environment aspect of One Health. Be ensuring that our environment, be it the trees, the nature, all the nature we have in the environment, the water bodies, is also safe and very vibrant for all the organisms that are supposed to thrive there to thrive, but also for us to benefit from their natural purpose. Yeah, the air conditioning, or let me call it like that, but we know the very big role that trees also play when it comes to cleaning up our air, to providing us, supporting the rain cycle formation. So also environment is very key. Let's not only take care of ourselves, I'm washing my hands, I'm doing this, I do this, but then however much you try to protect yourself, but if our environment and our animals are not doing well, you'll always find yourself in a cycle of a certain infection. Yeah, so we have to really work hard as health personnel, that while you're out there, you get any chance to talk to the community, let's always blow the trumpet of balancing human health, animal health, and also environmental health. If you have a question, I can't, or you're raising your hand, I'm screen sharing, so I can't see them. You just please go ahead and unmute and feel free to ask your question. Okay. Moving to the core principles of One Health, like already said, One Health, this is just the interconnectedness of the three arms of life: human health, animal health, and environmental health. It strongly sits on collaboration. So for One Health to be successful as an approach of either solving any complicated um, problem you've identified in society, then you have to work with other stakeholders. You're not going to work alone as health workers. So you as the health workers have to bring on board people who are handling the animals, be it wild or domestic. So you have to bring in the veterinary people, personnels, you bring in also the wildlife conservationists. Then environment, you have to bring in the environmental conservationists and work together as one, so that you all cross share knowledge and find the best solutions for you to address a given challenge you have identified. It's a very, very cost effective and efficient approach to use in addressing health challenges, but also issues regarding food security, because it brings in different stakeholders from different sectors to work together and intervene as a team. Then another core principle of One Health is prevention. It mainly focuses on preventing disease. It's a preventive medicine approach and not more of a curative. So it's best implemented, or best to forget the best results out of it. It has to be done to prevent a disease before occurrence, but not as a curative methodology. Um, One Health also strongly stands on the principle of sustainability. So for everything you're going to use it for, to intervene and offer solutions to society, then you have to always choose approaches or interventions that ensure sustainability. You're not going to create a dependency in the community, but rather always intervene with solutions that are quite more sustainable, that even if you left tomorrow, either as an organization or the office of that district or state, then this society, this community can still carry on the knowledge and the skills that you equipped them with. So getting back to One Health and social entrepreneurship, These are all very, very interconnected disciplines because they all address complex societal challenges that either government or other implementing partners have really failed to address, or they have addressed and there are still gaps and inadequacies that still have to be covered so that society has a healthy life. And they all both leverage on innovation. It's not written in stone that for you to have a successful social entrepreneurship venture, it has to be, let me say, you have to set up a hotel, you have to, no, it's not really written on stone. So you have to be as innovative, as creative as possible. If you're creating a solution for tap water access, make it very creative that you're going to make the end user of your product really, really appreciate what you're giving them and not adding on costs on already what they're buying from you. You're creating a solution for safe water, create a ceramic pot that you know that this person is going to buy one time. They don't need power, they don't need to boil the water, they don't need to worry about cooling the water, and then they have they just get water, pour in the pot, it filters it, and they have a clean cup of water to consume. So you have to really be creative when you're thinking of social entrepreneurship ventures, but also when you're implementing One Health, you also have to be very innovative. It's not written in stone. Like I'll use an example, treating a malaria case. That one, you know, when a malaria case is confirmed, this and this and this and this is what you're supposed to administer. That is not what happens in preventive medicine. Preventive medicine, you have to really be innovative because things change each day. The way you responded to a cholera outbreak in community A might not be the way you respond to a community, sorry, to a cholera outbreak, for example, in a refugee camp, because the settings are different and you'll always have to be up on your feet to think and try to really embed what you have learned in school, in class, to fit this particular community or context. So it's quite interesting. Public health, preventive medicine. Yeah, for the people who are just starting the course, this is a very, very interesting course you will like because it really gives you leverage to create, to be innovative, but always at the back of your mind, have the ethical considerations and the co-humanitarian standards. Always key that when you're doing anything to help the community, however innovative and creative it is, at least have the ethics in it. Protect people and do not cause more harm. Okay. If you have any question, feel free, always raise it. Still, I can't see your hands. Another interconnectedness of One Health and social entrepreneurship is the community engagement. Yeah, like I earlier said at the start of the session, you'll not have successful preventive health approaches without community engagement and participation. This is very key. It's like the first principle for any successful preventive medicine approach or intervention. Everything you do, always engage the community. Yeah, most of the solutions you're going to implement have the community look at them, discuss with them if they really work for their context, because everything we have to do should be context specific. So community engagement and participation is very key, both in One Health, excuse me, and social entrepreneurship. So you really have to base your interventions on locally adapted solutions and the locally available resources. That is very important for you to have that aspect of sustainability. You're not going to carry equipments from, let me say, for example, in USA, and come and, implement in a rural community here in Sudan. It really doesn't add up, because where are they going to get resources to sustain this? So everything should be locally available and community driven. Okay, moving now to the challenges. Like we have seen, the two arms, One Health and social entrepreneurship, are very keen addressing the challenges we are facing in this century. These are some of the challenges. We have the rising zoonotic disease challenge. Most of our outbreaks right now in Africa we are suffering have either been from a wild animal, yeah, or even these usual domestic animals we keep with us. So zoonotic diseases are really growing, and they continue to threaten the African continent in particular. And we really have to work hard on this. We also have the vector-borne diseases, which is like right now, malaria is like the top leading cause of death in some countries in Africa. And this is really vector-borne. And we really have to do something about it, because they thrive best in this environment that we are sharing with. And once we encroach on it, we are causing more trouble for ourselves. Issues of also environmental degradation. We are cutting down trees. It's now at some point you can even think it's a hobby for some people. Yeah. And it's causing more harm than good. We are losing out on fertile soils. We are losing out on rainfall. We are losing out on crop yields and ending up with malnutrition, ending up with food insecurity. And these are some of the approaches we can use to address this. Social entrepreneurship, you can think of a venture. Yeah, think of a venture and just know, okay, it's for the business oriented people that I can get here money, but also I'm supporting the community to have access to more food, to have access to clean water, to have access to health, to quality public health services. Then also there's a growing challenge of antimicrobial resistance. Yeah, and most studies and these days that are being published are linking antimicrobial resistance to some of the different changes of climate, and also the bacterias and the different microbes are also starting to take on mutations. People are abusing more of the drugs that we are supposed to take on prescription. So we are also having a lot as a growing public health problem of antimicrobial resistance. And we really have to act up as health workers so that this doesn't really go out of hand. We don't want to reach a point and we can't treat people who come in facility with the medicines we can afford as a nation, as a continent, because people are resistant to all these medications just because they're abusing them. So we have to start as soon as possible with the young, growing health workers in preventive medicine, even those in curative medicine, to do something about these challenges. And these are some of the approaches we can use: One Health and social entrepreneurship. Yeah. Another application of One Health and social entrepreneurship is navigating some of the complex situations we face in our communities. Yeah, sometimes we are really tied of, to implement successfully because of either political, cultural, and economic factors in societies. But the fact that these approaches, at the core of them, for you to implement and succeed, you have to engage different stakeholders at different levels of governance up to the local level. Then these are some of it's they're very good approaches for you to use in such complex situations where there are very, very strong political, cultural, and economic challenges. Yeah. Then also they can be used to really serve marginalized populations, the vulnerable populations that have been neglected. Some are sensitive, depending on the country you're working in, but if all the laws governing the country really define this group as marginalized and vulnerable, and they have been neglected, social entrepreneurship and One Health are very good approaches for you to do service delivery and also tackle very, very severe challenges they face. Vulnerable populations face a number of challenges, a lot of challenges, because they don't have equal access to services the way the non-marginalized have. So they are very vulnerable to mental health issues, they're very vulnerable to malnutrition, low self-esteem, and approaches like this that bring them at the center to also have a chance to make decisions about the kind of services and interventions they receive are very great and can be used in such in such times. Okay. Any questions up to there? Okay, I'll assume silence. Everything is moving on well.
Yes.
Okay, great. Also, One Health and social entrepreneurship can be used in identifying stakeholders. For example, you have got this project, you have to go and implement it in a certain community X, and then you have to onboard different stakeholders at different levels, either government of district officials, state officials, government authorities, ministries and departments. But then you need to target the very core people that support your project that you're going to implement in this setting. Then One Health can really help you identify key stakeholders to work with, because you're going to bring all these different bodies together, and then they have to help you out to decide on which interventions work best for their communities or for themselves. And from here, you score the power and influence of these different stakeholders and know that, okay, stakeholder Ministry X will be very key in this intervention than Ministry Y, and you can really sieve out the people you can work with. Same also to identify beneficiaries of a certain intervention. This can also be very, very key in case you have a project and you need to identify the very core beneficiaries of the project of the intervention, which you're not sure of. Go to the community, interact with them, interact with the society, look at the animal aspect, look at the environmental aspect, and then you draw conclusion of who your target beneficiaries are. Same as building allies for a particular intervention you intend to implement. Okay. Then another way One Health and social entrepreneurship are really, they work hand in hand and interlinked. Social entrepreneurship promotes biodiversity. And we know biodiversity is very key in one of the environmental and animal health aspects. Yeah. So creating a business that really boosts biodiversity conservation, for example, ecotourism, while providing livelihoods for local communities, can be very good. You're hitting two birds with one stone. You're at least providing an income for the community, but you're also protecting the natural habitats of some of these animals so that we do not have spillages of zoonotic diseases into the human population. Yeah. Then also it is very essential in pollution reduction. For example, if you created a social venture for waste management, Waste management is also a big problem in I think all the cities right now in Africa. And this is also a very viable opportunity for social entrepreneurs to develop smart solutions for waste management. So you're guarding human health from some of these diarrheal diseases, but also you're safeguarding the environment, because as this waste continues to be, for example, the polythene bags, we all appreciate what the polythene bags do to our soil. They prevent water percolation into the soil. Before we know it, we are not having any fertile soils in that place because of the waste that is that there. Also, the decomposable waste that contains very toxic substance, that kind of substance that you always see on waste bins coming out of your bush. So
Your microphone is breaking.
is it much better?
It's there. It's okay now.
Okay, where did you last get me at?
Maybe you explained that earlier last that very slide.
Pollution reduction.
Yes.
Yes, I was saying waste management is a growing problem in all the cities right now in Africa, because we have outgrown what our governments or public health departments developed as waste sites for waste management. Last month in Uganda, we just had it was very tragic. A waste slide. I just have to call it a waste slide, surely, because a heap of waste where we're dumping the city waste just collapsed and killed hundreds and hundreds of people. So social entrepreneurship, this is an aspect where a social entrepreneur can develop a solution, a smart solution for waste management. Yeah, but this, you're not only creating money for yourself, but you're also protecting human health from such tragedies of having to be killed by waste slides, of having diarrheal diseases, and also you're protecting the environment from the polythene bags, but also the harmful substance, that greenish substance that always comes out of decaying waste. It's a very toxic substance, and it also really destroys our soils so bad. So this is also a very key role that social entrepreneurship can play in promoting One Health. Okay. Um, Despite all these good approaches that we still have challenges. Yeah. We have to really appreciate that in most countries in Africa, public health is not yet very strong. This is something we have to appreciate and have to really fight for and push forward, because really preventive medicine saves a lot when it comes to healthcare. It really saves a lot and decreases the burden on healthcare facilities. We are still investing more in curative medicine and not yet public health. Yeah. So funding is really a problem when it comes to implementing public health interventions. And this is something we really have to, as you prepare to come into the job market, or those who are already in the job market, once you get opportunity to talk about public health, really talk about it with pride and advocate for resources to be also injected more into preventive medicine. Yeah. Another challenge in implementing some of the One Health and public health approaches, be it also social entrepreneurship, is the complex stakeholder coordination. Like I said earlier in the session, for our approaches as public health, as One Health, as social entrepreneurship to really be effective and successful, you need departmental coordination or stakeholder coordination and collaboration. You have to work together. People from public health, people from environmental health, people from veterinary or from animal health. All these sectors have to come together. The private sector, the businesses, they have to come together, work together. All the issues from the different arms have to be laid, and you come up to a common ground and implement what you have decided. But this is also a challenge, because sometimes other departments feel like these people are either doing our work and they're going to chase us out of the system. There is always that fight between different stakeholders of unknown fears. And this is something that is still challenging successful implementation of public health interventions, because there are always those fights between different either health, public health and environmental health, or public health and sorry, the domestic animal health workers, and then the wildlife animal health workers. So there are always those small fights, and bringing all these departments and bodies in one room to discuss something is also a challenge. So it's not easy, and we really have to do a lot of mindset change on these intercoordination and collaboration workshops, and working together for a common goal. But on the positive side, there are also opportunities. Yeah. One Health is a very growing approach that people are adapting, not only in addressing health interventions, by the way, but in sectors like agriculture. People are trying to find ways of integrating One Health to boost agricultural production, to address food insecurity, to address a number of challenges. So it's really growing, and it's some area that you can pick up interest and start to read more about. It's a very interesting approach. Write projects about, and you'll not be disappointed. Yeah. So that those are some of the opportunities out there when we talk about One Health. Social entrepreneurship as well is also really gaining interest by different organizations. So these are, you have to pick them up, be creative, write projects about, and yeah, you never know. You could just have a project that can support your community and have, better health indicators. Yeah. So here I need let's share let's share some of the examples from your communities. What are some of the examples you see for social entrepreneurship or a social venture that someone established that is promoting good health outcomes, or that is really linked to One Health? Is there anyone who would like to share?